The overall goal of this procedure is to obtain developing embryos derived from oocytes that were manipulated in culture. This is accomplished by first isolating donor oocytes from one female and manipulating them as desired in culture. The second step of the procedure is to stimulate these oocytes to mature using progesterone and to inject prospective host females with gonadotropin to stimulate egg laying. The third step of the procedure is to stain the donor oocytes with vital dyes and prepare a female to serve as the host. The final step of the procedure is to surgically transfer the donor oocytes to the body cavity of the host and several hours later recover and fertilize the transferred eggs. Ultimately, normally dividing embryos derived from the experimentally manipulated donor oocytes can be obtained and analyzed just like normal embryos.
Hi, I'm Doug Houston from the University of Iowa. Today we're at the Cold Spring Harbor Xenopus course to show you how to perform the host transfer procedure. We use this procedure in our laboratory to study the roles of maternal gene products and determine their roles in early Xenopus development. So let's get started.
Before beginning surgery, be sure that the surgical area is disinfected and that fresh media and sterile tools are ready. Grasp a suturing needle in the needle holder in the desired orientation. Place an anesthetized female frog on its back on a damp surgical wipe. Using small iris scissors, make a 1 centimeter incision in the skin in the lower part of the abdomen, lateral to the midline. Do not cut into the abdominal muscle. Use forceps to lift the muscle layer and surrounding white-colored fascia. Use the iris scissors to make a single swift cut straight down through the muscle. Extend the incision to 1 centimeter, exposing the ovary. Use forceps to grasp the ovary and pull out a lobe. Use scissors to trim the lobe off at the level of the body wall. Place the tissue in a 90 mm dish containing oocyte culture medium, or OCM. Immediately assess ovary quality under a dissecting microscope. A few oocytes can be defolliculated with forceps. If the oocytes are firm and of uniform size and coloration, remove the desired amount of ovary tissue from the frog and place in a 90 mm petri dish of OCM. Close the incision. Insert the needle a few millimeters lateral to the incision, making sure to pass through both muscle and fascia. Use forceps to manipulate the needle, taking care not to pull the tail of the suture all the way through. Close the wound with a simple interrupted pattern of suturing and surgeon's square knots. The technique is described in detail in the accompanying text. Repeat the suturing with the skin layer. Rinse off the female with deionized water and place her in a recovery bucket filled with cool water. Immediately after finishing surgery, use scissors to subdivide the ovary. Cut open individual lobes, flatten them, and cut into 2 cm square pieces. Rinse with clean medium and use forceps to transfer 5 to 6 pieces to a fresh 90 mm dish of OCM. To isolate individual oocytes, begin by transferring one of the pieces to a small dish of medium and bring to a dissecting microscope. Use watchmaker's forceps to manually defolliculate 300 to 500 oocytes. Grasp the connective tissue layer surrounding a fully grown stage 6 oocyte near the stalk. With a second pair of forceps, grasp the ovary adjacent to the oocyte. With the first pair of forceps, lightly pull across the oocyte to tear open the follicle layer. Gently tease out the oocyte from the tissue. Successfully defolliculated oocytes have no visible blood vessels and are floppier than oocytes with intact follicles. Use a cotton-plugged, fire-polished pipette to transfer groups of 100 to 150 oocytes to 60 mm culture dishes containing 8 ml of OCM. Store the oocytes in their dishes at 18 degrees Celsius. The oocytes can now be microinjected as desired with antisense oligonucleotides or mRNAs according to any number of protocols, then cultured in OCM in an 18 degrees Celsius incubator. Use oocytes for transfer within 96 hours of isolation. On the evening prior to performing the transfer, incubate the necessary oocytes with progesterone to mature them. Add 16 microliters of 1 millimolar progesterone to the medium containing the oocytes for a final concentration of 2 micromolar. Incubate for 10 to 12 hours at 18 degrees Celsius. On the same evening, inject 3 to 5 females with 1,000 units of human chorionic gonadotropin per frog to induce egg laying. Leave females at room temperature or 18 degrees Celsius overnight. On the morning of the transfer, check under the dissecting scope to ensure that the cultured oocytes have undergone maturation. Thaw the vital dyes and spin at greater than 10,000 Gs for 5 minutes to reduce background from debris. Add 80 microliters of the appropriate vital dye to each experimental group of oocytes. Incubate at room temperature for 15 minutes on a rocker. Transfer the colored eggs to a 90 mm dish of fresh OCM and swirl briefly to wash them. Make a pipette to use for transferring the oocytes. Use a diamond pencil to score a past your pipette about 2 cm below the tapered portion and break it cleanly. This should create a pipette with a 1.5 mm bore, just large enough to accommodate an oocyte. Fire polish the tip until the edges are smooth without closing the tip. Oocyte transplantation surgery should be performed as rapidly as possible. Make an incision as before in an anesthetized female laying good quality eggs. This incision should be the minimum length required to just fit the bore of the transfer pipette, less than 1 cm. Swirl the dish of experimental oocytes to collect them in the center of the dish. Use the prepared pasteur pipette to suck up as many as possible. Allow the oocytes to settle into the end of the pipette to minimize the amount of liquid transferred to the frog. Use forceps to grasp and elevate one flap of muscle and fascia. Insert the tip of the pipette into the incision and slowly allow the oocytes to trickle into the body cavity. Repeat the process until all oocytes have been transferred. Do not release the muscle layer to prevent the oocytes from spilling out of the incision. Use forceps to grasp both sides of the incision and bring them together, allowing the oocytes to settle into the body cavity. Begin suturing the muscle and fascia layer as before, taking care to keep upward tension until the first knot is tied. Suture the skin. Rinse the frog with deionized water and allow her to recover as before. The frog should begin laying eggs normally after the operation. Beginning 2 to 3 hours after surgery, recover eggs by normal squeezing every half hour until the female stops laying. To a dish of collected eggs, add 4 milliliters of a suspension of freshly collected sperm in 1x mmR and incubate at room temperature for 4 minutes. Flood and rinse the eggs extensively with room temperature 0.1x mmR. Incubate at room temperature to allow activation and cleavage. Use cysteine at any point to remove the jelly coats. The transferred embryos can then be sorted into separate dishes depending on color and cultured as normal embryos. Typically, more than 2/3 of the transferred eggs will activate within minutes of fertilization, showing robust cortical contraction at the animal pole. In most experiments, over half of the transferred eggs will undergo normal first cleavage. Sometimes cleavage will be delayed 20 minutes or so relative to the host eggs. In our hands, 30 to 60% of the transferred embryos go on to gastrulate normally and will survive past the neurula stage. The transferred embryos will retain their vital dye color through many days of development. Embryos derived from uninjected control oocytes will appear normal, as expected. By contrast, embryos derived from oocytes injected with beta-catenin antisense oligos, for example, will have a ventralized appearance.
We've just shown you how to obtain embryos from oocytes manipulated in culture. When performing this procedure, it's important to start with healthy, full-grown donor oocytes and to use host females with high-quality eggs. Also, the success of the method tends to correlate with the speed with which you isolate oocytes and perform the surgeries, so it may take some practice before getting consistent results. So that's it. Thanks for watching and good luck with your experiments.